Very good morning to our audience on MASA's Facebook page, MASA's YouTube channel, Faculty of Dentistry, MASA's University Facebook page. I am Dr. Maan Al-Marzouk. I will be moderating today's webinar. Today's webinar will be about the dental specialties in Malaysia. The webinar's title, Dentistry is More Than a Cavity. Today's webinar will be about dentistry is a subject which is frequently linked to pain and anxiety, as well as tooth decay in a small oral cavity. Instead of being considered a distinct course by itself, it is frequently seen as a subspecialty of medicine. Most people see of it as another medical specialty that focuses just on teeth. They are not aware that in Malaysia, dentistry has 12 recognized dental specialties, serve the diverse range of oral health needs of the community. In today's webinar, our speaker will cover the various dental specialties, will highlight them, along with potential careers path for dental surgeon. Please welcome our today's speakers, Associate Professor Dr. Noor Azmatul Akma Binti Ahmed. Associate Professor Dr. Noor Azmatul Akma Binti Ahmed is graduated from University Malaya in 2002. She served the Ministry of Health as a dental officer for 4 years before pursuing her specialist training in UK, London in 2006. She obtained her Master of Clinical Dentistry in Prosthodontics with distinction from King's College, London in 2009. And she also awarded the membership of Restorative Dentistry in Prosthodontics from the Royal College of Surgeons of Edinburgh in the same year. Associate Prof. Dr. Noor Azmatul Akma research interest span range from tooth wear, prosthodontics, indigenous oral health care, and dental education. She was the head of Department of Restorative Dentistry in University Malaya from 2018 till 2021. And she currently member of the University Malaya Dental Education Enhancement and Development Unit and serves as a prosthodontist and restorative consultant in University's Malaya Specialist Center. She is also one of the examiners for the Royal College of Surgeons England Restorative Specialist Membership Examination. So it's my pleasure to introduce Prof. Noor Azmatul Akma to give today's webinar. Thank you so much, Prof.
Thank you so much, Dr. Maan.
Your
Thank
interest.
you so much, Dr. Maan. Yes, for the very elaborated opening. All right.
It's my pleasure, Prof.
So good morning to
I
all.
appreciate
First,
your
I would like to
interest, Prof.
say thank you to the Faculty of Dentistry, MASA University, for the invitation for me to share a little bit on dentistry. Yep. So my lecture or my sharing session today will be on dentistry. It is more than a cavity. Yep. So let's start. So usually when people talk about dentistry, when people talk about dentistry, I have to, okay, doesn't know. So when people talk about dentistry, I have something, okay, good. I don't know, there's supposed to come the words here. Okay, when people talk about dentistry, there's nothing that we will think of or the common people will think of apart from the tooth and nothing but the tooth. All right, supposed to come the words here, but I don't know why it doesn't work. It's all right. So it's all about the tooth. And when we talk about toothache, so usually people will look into, what caused this pain? So they look into cavity. So they will think about the hollow and small and maybe narrow passage to the pulp that caused the pain. So it becomes from small to minute, So people really zoom in about dentistry just about the tooth. But basically, dentistry is a profession that is concerned with the prevention and treatment of oral disease, including diseases of the teeth and supporting structures. And it also includes the diseases of the mouth, the oral cavity, and the head and neck, right? So usually what it does, what it includes is the diagnosis. So we diagnose, we prevent, we manage, yeah, the treatment of diseases, of disorders, or conditions of the mouth, the treatment and correction of malformation of the jaws. These include misalignment of the teeth and also birth anomalies such as the cleft palate. So when you actually join the dentistry course, yeah, the students we will be introduced, okay, to oral anatomy, histology, and embryology. So you'll see from the picture, you can see the cells, the amyloblast cells. Basically, this cell will actually layers out the hard outer layer of the tooth, which is called enamel. And you can also learn about odontoblasts, which these cells basically form the dentine. So from the development of the tooth itself, we will be introduced through this subject, yeah, or anatomy, histology, and embryology. Students will also be introduced to the development of the jaw and the face. So you can see all the different phases in the development of the face and also the palate, yeah. And next, we will be actually exposed and introduced to development of the teeth. So if you see here, I know it's a little bit small, but dental students, yeah, will be taught about when the teeth erupts in the mouth. So we have two sets of teeth. So we have deciduous dentition and also permanent dentition. So we have 20 deciduous teeth, yeah, and also 32 permanent teeth. So you can see here, if you know it's small, but usually the first deciduous teeth will come into the oral cavity at the age of 6 months, and we also have the first permanent tooth, which is the molar, to come out at 6 years. Yeah, so all of this will be taught to the students in their early years in the dentistry course. But not just on dentition. So when we talk about dentistry, so people think about it's just about the teeth. So basically, we start off with the teeth, but it actually now will progress to the disease and the area surrounding the head and neck. So the students will also be taught on the muscle of mastications and the temporomandibular joints. Yeah. So here, it is very interesting to see later if in your practice, patient will come, maybe sometime not really complaining of tooth pain, but they're having severe headache, right? They will come with severe headache and they will say that they have been to the GPs, the doctors, but it's still there. So they will come complaining of, they have sometime clicking of the jaw and maybe some stiffness of the muscles of the neck. So basically, the dentist dentists are the one that will actually have the opportunity to actually examine and also derive a diagnosis for the TMJ problems. So let's look at the specialties. Apart from what has been taught in the course itself, so I think whoever that wants to actually embark into dentistry or embark in the pathway of become a dentist later, they need to know that in Malaysia, there are 12 specialties, recognized specialties, the Malaysian Dental Council. Yeah, the first one is restorative specialist, then the prosthodontist, the endodontist, periodontist, orthodontist, pediatric dentistry specialist, special care dentistry specialist, oral maxillofacial surgeon, oral maxillofacial radiologist, oral medicine and oropathologist, dental public health specialist, and forensic odontologist. So you see, when we enter dentistry, I'm talking about myself when I first joined dentistry, basically I am not fully aware of what's next for me. So what are the specialties out there? But basically now I'm sharing that actually we have 12 recognized specialties at the moment. Yeah. So let's look one by one at the specialties. For restorative dentistry, okay, so it's a study that basically involve the three main subjects: endodontics, periodontics, and prosthodontics. So they will train in bits and parts of all the three components, and they are supposed to be able to integrate the management of diseases of the teeth and the supporting structures, and also rehab the dentition of the patient to achieve satisfactory functional and aesthetics requirements for each of the patients. So restorative dentistry, so they will need to learn and actually to learn the three subjects together, and now integrate the whole knowledge about the three to be able to treat their patients. Okay, so this is very vast, big specialty. The next one is the prosthodontics. So the prosthodontics is the restoration and maintenance of oral function by the replacement of missing teeth and other oral structures by artificial devices or appliances. So prosthodontists, I'm a prosthodontist, so we specialize in replacement of missing teeth, replacement of missing structures. Yeah, so we talk about how to actually give back what the patient have had before. Yeah. So if you actually embark on prosthodontics, so we will be taught on more extensive way on how to deal with more complex cases that involve crown and bridges, dentures, and also implant prosthodontics. When we talk about implant prosthodontic, means that the implant has been placed, and how to actually give the patient appliances that will actually be connected to the implant. So we will need to plan for that as well. So prosthodontists actually specialize in crown, bridges, dentures, implant prosthodontics, and also the full mouth rehabilitation for patients that have collapsed dentition. Collapsed dentition means that you need to rebuild again how the patient bite. Yeah, so this is prosthodontics. In prosthodontics as well, there's another subspecialty for prosthodontics to actually go deeper, and they will be trained on to do maxillofacial prosthesis. So maxillofacial prosthesis, like the picture is showing now, is artificial ears, artificial nose, eyes, and sometimes just the eyeball. Yeah. So basically, prosthodontists will be able to help patient that suffers from defect, oral maxillofacial defects, after the surgery for oral malignancy. Yeah. So this is for prosthodontists. Let's look at the second one, endodontics. So endodontics, I know in the undergraduate we have been taught doing the same thing in endo, yeah. So endo basically derived from the Greek word inside, and odon is for the tooth. So we look inside the tooth, yeah. So endodontic treatment or root canal treatment treats the soft pulp tissue inside the tooth. So usually, if patient comes with extreme pain or swelling near the what we call the gum, the buccal sulcus, so having difficulty to chew because of the pain, so endodontist, the endodontic specialist will actually investigate and carry out treatment as needed, and usually it's about the root canal treatment. So for undergraduates in dentistry, they were exposed to do single-rooted tooth, and also exposed of doing multi-rooted RCT on multi-rooted tooth. However, it is because of the anatomy of the teeth itself, the variety of that, some of the cases will need to be treated by specialists with using microscope. Okay, so certain cases is just beyond the scope of GP or the dentist itself, so the cases will be referred to the endodontist. So endodontists also will do endodontic surgery. Okay, so here they will actually do a little bit of surgery to actually remove the inflamed and infected tissue from the apex. Okay, and then redo the root canal again. So periodontics. So the third one, let's look at the perio. Okay, so periodontics basically it is a field that looking into the structure of the teeth as well as the diseases and conditions that affect them. So they look at the supporting tissues that is known as periodontium. Okay, these include the gingiva, alveolar bone, cementum, and the periodontal ligament. All right. So when we talk about periodontist, most of them will think about, okay, just periodontist. When you become a periodontist, we'll just do scaling. But it's not. It's not it, yeah? It is more than scaling and polishing of the teeth. So basically, I can consider periodontist as similar. This is from my opinion, yeah, my exposure, my experience. I think periodontist is really like a plastic surgeon in the dentistry field, because they are trained to handle the soft tissue very well. Yeah, so they are trained very well in handling the soft tissue softly. So they're very careful. So they usually do a lot of surgeries as well, like the bone grafting and also the soft tissue grafting. So usually restorative dentists or prosthodontists will actually work together with the periodontist to actually plan for how the restoration and how the soft tissue will actually be molded, yeah, to achieve a very good aesthetic outcome. So periodontist for me is just like a plastic surgeon. So periodontists also do implant surgery. So this implant surgery, a lot of us thinking that, what about the implantologist? Is it considered a specialty? At the moment, implant surgery is not, is an area that is shared by a lot of specialties. So periodontists do a lot of implant surgery, oral surgeons definitely, and also prosthodontists. But it's very important to know that it's not the implant placement that's the most important. It's usually the planning part on where you want to place the implant and how you want to actually restore the implant must be planned well to achieve a very good outcome after the surgery. So I think all the specialties will need to work together closely to ensure that the implant surgery, the implant case will be achieving a good outcome. Yeah. Okay. Very famous specialty, orthodontist. Okay, the orthodontics. So these orthodontics, yeah, it deals with the diagnosis, prevention, and correction of malpositioned teeth and jaw and misaligned bite patterns. So basically, not something wrong with the occlusion, talking about maybe the patient basically not, some of the teeth not touching, some of the teeth are misaligned, it's out of the arch, yeah. And also for some patient that having some problem with the growth of the jaw, yeah. So orthodontics also will focus on modifying facial growth sometime. So it is also known as the dentofacial orthopedics. Okay. So orthodontists will usually place braces and will work together closely with the oral surgeon to plan for orthodontic surgery in certain cases. So in the picture shows that, they will actually cut the jaw back and move it forward to allow a more acceptable patients for fun. And most important is the occlusion and how all the upper and the lower teeth meet. Pediatric dentistry. So pediatric dentistry or specialists, yeah, I can consider them as the most patient of all. Yeah. So pediatric specialists, dentistry specialists are gentle, very gentle. So they are good and they are trained to actually handle infants and children through adolescence. So they have been trained to do most of the treatment like restorative dentistry, but it is an age-defined specialty. All right. So they will handle both the primary and also comprehensive treatment on primary tooth and also permanent tooth in child. So they are very, very patient. So pediatric dentistry, pediatric specialists as well will handle dental clearance under general anesthesia. So in the OT, yeah, in the theater. So they basically look at how they can maintain what is there in the child's mouth while waiting for the permanent teeth to erupt. You can see here that they will train sometime, yeah, in certain case where they need to retain, yeah, the deciduous tooth or teeth while waiting for the permanent teeth to come out, yeah, into the oral cavity. They will do pulp therapy and also metal crowns for the patients. Looks Sometimes people think, yeah, it's small, it might be easier, but however, the management of the child patient is not easy at all. So they are trained to actually treat this age-defined group of people. Special care dentistry is quite, I can say it's new, but it's not really new, but among the latest specialty, special care dentistry is also known as special needs dentistry. Okay, so basically they also do most of the restorative work, but it is concern of a special group of people, like the people who have intellectual disabilities, okay, or by other medical, physical, or psychiatric issues. So they treat a special group of people. You can see from the picture that they will actually handle and treat children with learning disabilities, and also adults. You can see here using special tools to actually lift up the patient, some adult patient with maybe physical or psychiatric issues as well. So they will need special care and they will need special management. So this group of specialists handle special cases. Next is the oral maxillofacial surgery. So this is what we call people that want students that are really interested to do surgery. So basically, they can be maxillofacial surgeon. So this this field, includes the diagnosis, the surgical and adjunctive treatment of diseases, injuries, and defects involving the functional and aesthetic aspects of the bone and soft tissues of the oral and maxillofacial region. So oral maxillofacial surgeon usually will handle cases like the cleft palate. They will repair the cleft palate. And the most common that I'm showing here is to do the minor oral surgery to actually take out the impacted wisdom tooth. This is quite common. Some of the general dental practice also will be doing this. So dentists are trained to do this, but if you learn and become a specialist, you will know maybe more about how to do it in a simpler manner, and a very effective and safe. Okay, so minor oral surgery, and they will also involve in treatment of injuries, especially after MVA, motor vehicle accident. The patient is traumatized. You can see for this patient a fractured jaw. So sometimes, most of the time, they will need to do what we call IMF, intermaxillary fixation. They will reduce the fracture, stop the bleeding, and then fix it together. All right. So this is very interesting for dentist. When you become a dentist, when you are supposed to go for your attachment in hospital, I think you will have the experience to do this on your own. Yeah. So the other one is oral maxillofacial radiology. So oral maxillofacial radiologists, okay, they will actually look and at the images, okay, and they will know more about the use of radiographic imaging techniques and how to actually help the clinician to diagnose, okay, based on the correct methods of what radiographic methods and imaging that is needed, okay, for the patient or for the clinician to actually derive at the diagnosis. So they are experts in interpreting and analyzing radiographic image. All right. So they are expert to identify abnormalities, tumors, infection, fractures, any anomalies, and also pathologies. So their eyes are trained for that. Yeah. So they are. So you see here they are used. So as dentists, we usually order all these views, bite wings, periapicals, and also dental panoramic radiographs. So here we will be trained as dentists, but sometimes there are gray areas that we will need the expert eyes here to actually see and help us diagnose the certain condition. This include the use of MRI sometimes. Is here you can see the identification of a tumor in the sinus. The next specialty is oral medicine and oral pathology. So oral pathologists basically a strain to diagnose, okay, then the natural and the non-surgical, and also to manage non-surgically the oral maxillofacial, the TMJ disorders, and also to diagnose oral malignancy. Okay, so they're trained to do this. So let's say some patients, have very, very strong pain, extreme pain on their face, that it can actually be diagnosed as having what we call trigeminal neuralgia. So the pain that involves the nerves, the area that is being supplied by the trigeminal nerves. Yeah. So basically, oral medicine or oral pathology specialists, they will look and they will try and diagnose and actually give the patient, manage the patient, and give medication for the patient to actually help in the management of the orofacial pain. And as I mentioned, they also train to diagnose and to biopsy and manage oral cancer as well. Okay, next is the dental public health specialist. Okay, dental public health specialist is a specialty that is focusing on promotion of oral health. They want to prevent oral disease. Okay, they want to prevent oral cancer. So they're working hard on prevention of the disease, usually at a population level, so a higher level. So they usually address and assess oral health needs of community and plan accordingly on how to promote and prevent oral disease in that community. So basically, dental public health specialists are the policymakers, and they help usually the institutions and also the nation, on how to control and maintain the oral health level of that the community and the nation. So they are very, very important in policy making as well. So usually oral health education, as a dentist, we have the obligation to also educate our patient. At a higher level, the oral health, dental public health specialist will also cater on how is the right way for us to actually educate the patients. So they will plan for us. And we have the obligation, as dentists, to always educate our patients. And oral health promotion, if you can see, usually the services will go even to the rural areas. And I think in the photo is showing that this orang asli community, the indigenous, where we will also try to actually promote oral health education to them, so that they will be able to continue to maintain a good oral hygiene and practices. Okay, this is oral public dental public health specialist. The other one is the last one, and last but not least, I think this is a very interesting specialty. It's called forensic odontology. It's also known as forensic dentistry. So it's very, very interesting, as usually they will work close with the police. Yeah, they will be looking into cases, into legal and criminal investigations. So I think most of us have watched this CSI, crime scene investigations episodes, where they will be left with, body parts, and this including sometimes the skulls. Yeah, so forensic odontologists will be able to help them identify who is the victim, what has happened, how old is the patient, it's not patient, how old is the victim, so it's very, very interesting. So as I actually shared here, you can see the forensic odontologist will be measuring the bite marks on victims, and sometimes, victims that is not identifiable anymore, they will look at the teeth, they will match it to the dental charting of the patients, and try to see either it match or not. So it's very, very interesting, this specialty. So the summary, if you look at this, so dentistry, Okay, remember when my first two slides talking about when you think about dentistry, you straight away think about the tooth and nothing but tooth, and the tooth is placed in a small oral cavity. But you see here now, okay, you see that dentistry maybe seems hollow, it's very shallow, but it's not void. A lot of things, yeah, it's a big field, and maybe seems small, but it's not insignificant, and can be narrow but not limited. So dentistry is big. It's something that is very interesting. Yeah. So let's see. So the next question is for the students that are already in dentistry course. So maybe why make you want to be a dentist? But for some, the school children that have their ambition and thinking of doing dentistry, the question is, do you want to be a dentist? And also you have to ask your question, why do you want to be a dentist? All right. So if in Malaysia, okay, you want to be a dentist, you have to actually graduate with Bachelor of Dental Surgery or Doctor of Dental Surgery from certain universities. So the first step is to excel. Yeah, you have to do good and well in your high school, yeah, STPM, or matriculation, and also foundation studies. So you have to strive and get good grades, yeah, during your foundation and matriculations. And then you should be able to refer to the entry requirements for the universities of choice. So where do you want to pursue your BDS? So you look into the website of all the institutions, then you will be able to see and compare what was needed. All right. So then you can match your achievement to the requirement of the schools, because the different schools usually have different entry requirements. Okay, and this course is usually a 5 years course. Okay, so I'm just taking this from website. You can see that after you do for dentistry course, BDS course, it's a 5 years course. It is taught in English, and apart from you have to be excellent in your science subject, you will also need to be excellent, or you have to actually pass certain level of English qualifications, because the course is being taught in English. And to actually be selected into the course, I think most of the schools now in Malaysia have what we call the interview. Okay, so you're pre-selected into the pool, all excellent students being selected into the pool, and then from the pool they will be actually scheduled for interviews. And from that, after that, if you're good and lucky enough, you'll be selected to be one of the dental students. All right, so these are the path of how a student going into dental schools. Okay, let's look. Okay, let's talk about after 5 years. So after the 5 years, or maybe more, okay, so you will become the dentist. So you will graduate and be the dentist. In Malaysia now, okay, there will be a 1 year period of attachment. All right. So when in 2002, the year which I graduated, I have served 3 years compulsory service. So during the 3 years of compulsory service, you will be exposed to the system of the Ministry of Health system on how to treat the community. Okay, so because now you have been trained in the classroom, in the institutions, where patient comes to you, and you can actually decide it on what to do, on how to treat the patient, and you have all the backup support from the specialist with you. But later on, during the attachment, you will gain more experience by managing small clinics yourself. So you will be managing certain cases. Then you will also learn on how to refer to a specialist, especially if the case needs further attention that is beyond your scope of training. So once you're 5 years, then you become a dentist, and in Malaysia, you'll go for the attachment. Now it's 1 year, yeah. Okay, you're dentist. You know that you will go out, and be a dentist. For the first year will be with the government service, the Ministry of Health. Okay, let's look at the pathway. Okay, after you become a dentist, so you can actually decide either you want to be full-time clinician, okay, full-time clinician in the government service, or do your own private practice. So you can become a general practitioner, or you have the passion to teach. Okay, you want to share, you want to have the passion to teach. You might want to think about joining dental institutions. Okay, but to join dental institutions, you definitely need to do your specialist training first. Okay, so you have to do your specialist training, then you can be part of the academia profession, okay, the group. Or certain of you wanted to join the industry, so there are possibilities or pathway as well for you to join the industry, to be an industrial players. Okay, so let's see. Let's say you aim to be an academic. Okay, you want to join the academia. So you have to bear in mind, to be in the teaching institutions as a dentist, you have to train, you have to actually embark and enroll in a specialist training course. And once you graduated as a specialist, then you will be able to join the academic world, and you have to play the four main roles. Okay, as academician, you will be a teacher, you will teach, all right? You will also see patients. You continue to be clinician because you're a trained specialist, and you will now be trained and involved in administration of the staff, the clinics, yeah, so administrations and also researcher. So if you join the academic world, definitely there's no other way but you have to now do research. Okay, there are ups and downs of it, and some people might not really want to do research but really like to teach. So it depends on the institution that you join, whether the weightage of doing research is high or equivalent of the teaching. So really back to the institution that you will join. But doing research is basically good, yeah. So you will be able to get the support to do what you want and what you're interested in. Let's say you want to know why, in certain areas, there's no services in that area, no dental support services in that area, not very good. People go just once, maybe in 2 months, but the oral hygiene of the people are still okay. That not much teeth are decayed and all that. So you might want to know why does it happen. So you might want to do a research on that as well. So you'll be supported by the institution that you join. So academic life can be interesting, can be also sometimes frustrating. All right. So depends on your mindset and what you want to be. So academician is an option after you actually graduate as a dentist, or you can actually now step up and proceed as an entrepreneur. So you can actually set up your own private practice. You can be your own boss. You can actually explore the business world through your practice. And also, if you love teaching, nowadays, I think very recently, few clinics, general practitioner clinics, has been identified as the posting center or a training center for first year dental officer. So you will be able to also teach the new dentist. Yes, certain practice has been identified as a training center as well. Okay. Industrial players, so some of the big companies needs dentists. So they will need dentists to also join them as product experts, okay, to go and teach, or to be together with them to talk about the new materials that they are selling. All right, they become product experts. And also in certain countries, I think I'm not sure in Malaysia now, but dentists have ideas, how to actually improve the service in dentistry. So just an example, in Korea, the dentium system, the Korea implant system was actually invented by a dentist. And the dentist invented the implant system and basically be an entrepreneur and make a very big, worldwide recognized companies selling dental implants. So basically, you can also join the industry. So it's nearly the end, conclusion. Okay, so I think everyone should see dentistry as an advancing field. So with the changes in the techniques, in the technology, there's a lot more to learn, and it continue to be, continue to change and advance. So you'll be able to do a lot of things. So it's not stagnant. So dentistry is not stagnant. Just look to the patient's mouth and fill up the patches, the tooth. No. All right, so advancing field. It offers you a wide range of spectrum of what you want to do, what you want to actually embark on, what you want to try out. Okay, and also it offers you the opportunity to learn and to sharpen your skills. Yeah, and also open the door to research and entrepreneurship. So dentistry is like a tree and a lot of branches that you can actually choose and explore. So I think that's it. Thank you, everyone. I hope you have actually learned a few here and a few tips from me about what's there in dentistry. So all the best always. Thank you so much. Dr. Man, I can't hear you.
Yeah, I was unmuted, Prof. Thank you so much, Prof. Noor Azmatul, for the informative presentation. It's really very informative for the people like foundation students who want to join dentistry, because they don't have an idea about the career path and about the different disciplines of dentistry. Yeah, even some students already make up their mind and come for interview. Sometimes we ask them about what to expect after graduation. They don't have an idea. Yeah, so I think this presentation will be a good reference for them.
Yes.
I
Thank
really
you.
advise
I think it's best
share.
to open the eyes, isn't it? Open their eyes to, so what's there after dentistry? So what can I do? What do I really want to do, isn't it? So actually they can now have the time to think and reflect.
Exactly.
I hope so.
Yeah. Prof, I have some doubt about the implant dentistry. You
Yep,
mentioned in the presentation that it is not yet a specialty
yep.
in Malaysia and other like developed
Um,
country.
yep.
But people want to study further about the dental implant. Do you have any suggestion for them?
I think, okay, once you made up your mind, after you become a dentist, I think, yeah, my advice is for you to explore all the specialties. Because sometimes you think that I want to do this, but basically you don't know either you up to it, you really, are you really up to it or not. Means that the lifestyle that comes with it, or the responsibility. So try everything out, and so that's why I said the attachment is very, very good. So you can try and see what really happening in the specialty, then you decide. Let's say now at the moment implant dentistry is not a specialty, all right,
Yeah.
but you're really interested to do implants, not a problem, because usually now implant dentistry are being taught as short courses sometimes, or a part in certain schools. The implant dentistry is also embedded into their curriculum, okay, part of it. So let's say you are trained in perio, but the course itself, you can read the course outcome from the institution that you want to join, so you can see either it covers or not the implant subject. If it covers, so basically you will be taught on it, and you will be able to actually practice dentistry, implant dentistry, during your training. So once you graduated, definitely as a specialist, you will have, I think you're trained in prosthodontics, definitely trained in periodontics, but, and also trained in oral surgery. Yeah. So you look at these three courses. I think in the course learning outcomes, you can see. So if you're trained, then later on, if you experience, you can also just join. You can just further continue to actually train and join some short courses if you want to do more in
Yeah.
the moment.
Does it cover in restorative dentistry as well, Prof?
Yeah.
I mean, the implant?
Restorative
Yeah.
dentistry, I think it depends. You might be exposed to it, But I think it depends on the course and the duration of the course and what will be included into the course outline. Because for restorative dentistry, usually, because you have to cover all the three main fields, the endo, perio, and a little bit of prosto as well, it is quite, there's a lot to cover. So you might be able to cover a bit on implant, but not as much, I think. But depend on the course that is being offered by different institutions. So you should be able to refer to the course itself and what's being taught.
Yeah, sure, Prof. I think Malaysia University, actually, our Faculty of Dentistry offer postgraduate courses. One of them is the restorative dentistry.
Yep.
Yeah, and we also cover about dental implants,
Yes,
actually,
great.
as a part of
Yes.
perio for the planning part and the
Yes.
the prosthetic part of it.
Yes.
Yeah,
So of
so
course in
yeah,
training, sometimes
cover.
you do a bit, but later on in practice, you can continue to actually gain more experience by doing it.
Yeah,
Yes.
exactly. Yeah. Yeah, dentistry also is a lifelong learning, so cannot
Yes.
stop only even
Right.
cannot stop with the dental degree or the postgraduate. It's
Yes.
yeah, developing topic. There are a lot of inventions, a lot of development, so we have
Yes,
to be
because
updated.
I think because of the advances in technology, you see now
Yeah,
they're getting more and more new materials as well. So you should learn either because when you graduated, when you actually become a dentist, you might not have heard of these materials before. So you should be able to know, uh, is this why is it better than the previous one? You know what I mean? How to use it the correct way. And like now with the implant system, there's so many implant systems in the market. Which one do you think that will suit you and your practice? And how to ensure that you have chosen the right one for your patient? Okay, the treatment on the implants and all this. So it is really a course that continue to you need to continue brainstorming, learn new things. So I think it's very interesting.
yeah. Thanks, Prof. And one last thing, Prof. I think from my experience with the patients, nowadays the patients are more aware about the different disciplines in dentistry.
Yes,
Can
I
you add
I,
something
I
about
think
it, Prof?
I think okay now with the advancement of social media now with all the Instagram all this there's good and there's bad things. The bad things I think is not only the dentists can promote their work, but the fake dentists also can promote their work. You know what I mean? So
Yeah, there's
but
few
now
stories.
there's yeah, so everyone can actually promote themselves doing the best thing in the profession. But I think now because of also the promotion by the Malaysian Dental Council of what's needed. So they are all now the new Dental Act that you need to actually, if you are actually a specialist, you also need to register as specialist. So patients are now more aware about is their dentist a real specialist or not, a recognized
Yeah,
specialist or
registered
not.
by
Yes,
council.
to be registered, it's not as easy as you send your name, isn't it? It's not as easy as that. So there are few requirements that you need to do and send it off to the committee, and the committee will actually review it case by case basis to see either you are really up to the quality that they want, and then they will actually recognize you, give you a cert, and register you as a specialist in the list. So I think more and more patients know about it now. So if it's really important for you to actually know about the requirement first. Now, since you can actually check in the Malaysian Dental Council what is needed and tick all the check boxes, and then it will be facilitating your way to be recognized as specialist.
Yeah. Thanks so much, Prof.
Well, thank you.
Yeah. I don't have any more questions, Prof.
Right.
I really appreciate your contribution today to our
Thank
Faculty of Dentistry, Masa University's webinar series. Thank you so
thank
much, Prof,
you. Thank you
for
so much,
your very good time.
everyone.
Thank you so much for a
Thank
formative
you so
presentation.
much.
Yeah.
Thank you, everyone. Bye. All the best.
Thank you so much, Prof. Have a nice day.
Bye, guys. And you too. Assalamualaikum.
Prof. Thank you. Thank you for joining, Prof.
Yeah, thank you.
Okay, I may end up this webinar for today. There will be another webinar by Department of Dental Public Health at Faculty of Dentistry in Malaysia University. We'll be organizing another webinar after 2 weeks, 15 June. So I would like you to please stay tuned and follow up the announcement that will be given in our Malaysia University, our Faculty of Dentistry Facebook page. Thank you so much for your kind attention, and hope we'll see you soon. Have a nice day, everyone.